Hello and welcome to On Second Street. Today we're going to be talking about the sad reality that every single year in this country, thousands of patients are dying while waiting for various healthcare services from the government. Here to talk with me about this important topic today is my colleague from secondstreet.org, Harrison Fleming, and Emmanuelle Faubert, who is an economist with the Montreal Economic Institute. Thank you both for taking a few minutes to chat about this important topic. Harrison, I'm going to come to you first. Can you just provide an overview of what we've seen in this country when it comes to patients dying on waiting lists?
Right. So Second Street has been releasing an annual Died on a Waiting List report going back to 2018-19. And since then, we've known that 60,000, almost 60,000 Canadians have died while waiting for healthcare services in this country.
hmm And what do those cover when it comes to the types of procedures that people are waiting for?
Right. So unfortunately, this isn't data that's naturally tracked by government. So we actually have to go in and try to find areas where that data is recorded. And so we file FOIs in provinces that sort of target two different areas. One is diagnostic exams, and the other is
Mhm.
surgical wait lists, because both of those, that data is recorded once a patient passes away. So we have those numbers and we can
Mhm.
see that, which is what we use to get this through freedom of information requests from governments.
We're going to dig into this data a little bit more in a moment, but this is information that covers everything from hip operations, which you're obviously not going to die from, or it's unlikely, to cataract surgery, heart operations, and everything in between. Is that a good way of
Yeah,
describing it?
so it's a pretty broad spectrum in terms of what healthcare services patients are waiting for when they pass away. And so the reason that there is such a broad spectrum here is, like I said earlier, is because governments don't naturally track this. And so the only way that we
Mhm.
can do this is to look at the areas where this information is actually tracked. And so yes, when someone passes away waiting for a knee surgery, there's a very realistic chance that their death was not directly related to that wait list. However, when you're looking at this is
Mhm.
a person whose final years or final months alive were living in significant pain. And that's just not what our healthcare system is supposed to leave people at. And so, even though not all of these are, for example, people waiting for cardiac care, which we'll I think talk more about later, this is
Mhm.
a sort of cry for help from the healthcare system, saying that there's nearly 60,000 people who've died before they've even gotten healthcare in Canada.
Emmanuel, I want to ask you about this issue because at the Montreal Economic Institute, you guys do a lot of research on healthcare. You've been doing it for a long time. What are the signs of patient suffering that you're seeing when it comes to the research that you've undertaken or what you're picking up from other activities, news stories, and so forth?
Definitely, there's a variety of ways that we're seeing patient suffering. One of them is simply how long people wait in the ER, with how long they stay in the emergency rooms. We've seen that
hmm
people are staying a very long time, whether that is for major interventions, even sometimes things that are very minor. Part of it being because we lack access to primary care, being one of the factors. Another thing that we look at is
hmm
people being fed up with waiting and leaving before even getting treatment. There's multiple ways
hmm
to see this.
Do you think it's happening often that people are going into ERs with very serious conditions? They need things like, you know, some kind of heart procedure right away or some kind of other life-saving treatment, and they're not getting care and they're just leaving? Does that happen a lot from what you've seen?
It usually happens more for quote unquote less urgent or minor interventions. We see that
hmm
in Quebec, we have the classification of P1 being like reanimation, life or death situation, going down to P5, which is non urgent. And most of them are
hmm
in the category of P3 to P5. So either urgent, less urgent, or non urgent whatsoever. But there's still some that are considered P1, so reanimation and very gravely ill, that do leave before receiving treatment.
Okay, well, listen, when we come back, we're going to dig more into this issue and we're also going to talk most importantly about solutions. How do we start to reduce patient suffering in the healthcare system, especially when it comes to patients dying on waiting lists or before they get the care they need in ERs. We'll be back with more in just a moment.